Concussions represent a clinical diagnosis and a process which is usually self-limiting. Symptoms of concussions include headaches, dizziness, sleep disturbances, and difficulty concentrating. Standard treatment focuses on symptom control via medications and mental rest. Although the exact pathophysiology of concussions is not known, several mechanisms contribute to the clinical symptoms seen in concussions, including a disturbance in cellular function. Membrane disruption from acceleration-deceleration forces leads to neuronal injury, influx of ions, and accumulation of excitatory neurotransmitters such as glutamate. In addition to the standard of care, osteopathic diagnosis and treatment can be an effective tool in assessing and treating the symptoms of patients with concussions. Due to the mechanism of injury sustained in concussions, cranial and extracranial somatic dysfunctions may result. Many of these may be amenable to osteopathic manipulative techniques, including those directed at enhancing physiologic mechanisms for improvement of intracranial drainage. In this video, we will demonstrate the venous sinus drainage technique. There are regional variations in how this technique is taught with regards to sequencing and sinuses addressed. Before application of this technique, it is best to open up terminal drainage points, such as the thoracic outlet, the occipito-atlanto, and cervical regions. The goal of venous sinus drainage is to enhance the flow of venous blood through the venous sinuses to exit the skull through the jugular foramen, returning to the central venous circulation. A study cited in Foundations of Osteopathic Medicine observed that compared to sham control, the group receiving venous sinus drainage OMT had demonstrated improvement in hemodynamics at the cranial base as measured by ultrasound. With each step of the venous sinus drainage technique, the operator either applies a gentle pressure or a spreading with ounces of force and awaits a softening of the tissue as the endpoint. The treatment is performed with the patient lying supine and the physician seated at the head of the table. The first step of the procedure is directed at the confluence of sinuses. The physician places the pad of their middle finger on the external occipital protuberance and the hands cradling the back of the patient's head. Gentle pressure is applied in a posterior to anterior direction towards the patient's face. This is held until a softening is felt under your finger. The second step targets the occipital sinus. The physician moves their 4 finger pads of both hands along the midline of the occiput inferior to the external occipital protuberance towards the foramen magnum, creates a spreading motion, and awaits a release. The third step is applied in the region of the transverse sinus at the superior nuchal line. The physician places 4 fingers of each hand on either side of the external occipital protuberance along the superior nuchal line. A gentle pressure is applied anteriorly and held until a softening occurs. The fourth step is aimed at the sagittal sinus and applies a spreading motion along the superior sagittal suture. The physician crosses their thumbs and places them just superior to the external occipital protuberance on either side of the suture. A gentle pressure is applied to separate or disengage the tissues. This position is held until a softening occurs. Then the physician moves a finger breadth at a time, superiorly and anteriorly. This is repeated until the physician reaches the meeting point of the sagittal and coronal suture. The fifth and final step is aimed at the anterior aspect of the superior sagittal sinus at the frontal bone. The physician places 4 fingers of each hand on either side of the midline of the frontal bone and applies a gentle lateral traction. This position is held until a softening is appreciated. Osteopathic diagnosis and treatment involves assessment of the whole patient. Patients who have sustained concussions may have multiple areas of somatic dysfunction. There is no single correct technique to perform when treating a patient with a concussion using OMT. However, venous sinus drainage technique may be beneficial. Recent research describing the glymphatic system and evidence that biomarkers for traumatic brain injuries are transported in the glymphatic vessels may indicate a pathway by which OCMM works. More research is needed on how OCMM can facilitate healing and improve symptoms in patients who have suffered a concussion.